Welcome back everybody, David here again with Med School Bootcamp. So now in this video, we're going to deal with chronic pyelonephritis. Recall in our last video, we said that pyelonephritis, the root word pyelo means pelvis. We're dealing with the renal pelvis in this instance, and nephritis is inflammation of the kidney. So pyelonephritis develops when an infection from outside the body, commonly a bacteria, actually makes its way into the urethra, works its way into the bladder, which we would then call cystitis. But if it continues to work its way up the urinary system through the ureters into the kidneys, now we're dealing with pyelonephritis, or infection and inflammation of the kidneys itself. And so chronic pyelonephritis is dealing with persistent or recurrent acute pyelonephritis. So if you have pyelonephritis and it continues to occur over time, or it's there for an extended period of time, now we have chronic pyelonephritis. When we look at the pathophysiology here, we say that we're dealing with recurrent or inadequately treated pyelonephritis. Again, anything that allows it to stay around for a long time. Additionally, there's a particular subtype called xanthogranulomatous pyelonephritis, which is a subtype of chronic pyelonephritis that can occur from sustained pyelonephritis as well. It's also important to note that this type of pyelonephritis is typically unilateral, and we'll talk more about this later on when we discuss the imaging, but keep this in mind as a subtype of pyelonephritis. Now, when we look at our etiology here, remember, we said that chronic pyelonephritis is typically due to a prolonged period of acute pyelonephritis. So the etiology, or the factors that we talked about in the previous video, are going to apply here as well. But the ones I want to highlight because they're tested more commonly include its association with the infection of Proteus. Remember, we said that urinary tract infections are most commonly due to which microorganism? That's right, E. coli is the most common, but it's not the only type. There are other causes, one of which is the Proteus infection as well. And commonly, the Proteus infection can actually lead to chronic pyelonephritis, in part due to the fact that it develops these large struvite stones in the kidneys we've previously talked about, and these are actually pretty hard for the body to clear and pass themselves. Now again, there are several risk factors that can lead to chronic pyelonephritis, but I want to highlight the particularly high yield ones here, and these include VUR, which is vesicoureteral reflex. If you recall, this is when we actually get a backflow of urine. Typically, we have a continuous stream of urine formation in the kidneys, goes down the ureters, ultimately into the bladder and out through the urethra. However, various anatomical abnormalities, whether present at birth or due to things that occur later in life, can cause a reflux to occur, where urine is not going linearly down through the urethra, it's actually backflowing into the bladder, into the ureters, into the kidneys, and this can create a better environment for bacteria to survive, multiply, and ultimately cause infection. We can also be dealing with a variety of different chronic obstructions. One of the most common ones tested is kidney stones, right? If we have kidney stones, this creates an obstruction, ultimately creating a backflow of pressure in the kidney itself. However, we can also be dealing with some other obstructions, such as BPH in men or cervical carcinoma in women. And so just to review, if we have BPH or cervical carcinoma, we're essentially getting an obstruction downstream of the kidneys or the bladder. So if we have a structure or some enlarged anatomy, right, this is going to create a backwards pressure towards the bladder, which is then transmitted back to the ureter and the kidneys itself. This is why an obstruction can lead to a decreased ability to have our urine go from the kidneys into the bladder like it normally would. And this backwards pressure, again, creates the environment that allows a UTI to form and develop. Now, when we talk about the patient's presentation here, we're dealing with pretty standard findings that we would expect to see in acute pyelonephritis. We're going to have the flank pain, we're going to have the fever, and the malaise. These are systemic symptoms, important to keep in mind because this differentiates it from a patient who might have cystitis, which would not typically have a fever or other signs of systemic infection. So all in all, that is to say, this presentation alone is not helpful for determining exactly what the patient has, but it gives you an idea that we're dealing with a pyelonephritis most likely, and then your job becomes differentiating, is this an acute form of pyelonephritis, or has this patient had recurrent effects, damage to the kidney over time, kidney scarring, that's potentially looking more like a chronic pyelonephritis. When we consider our diagnostics here, we're going to always want to get the urinalysis. It's fairly easy to get, fairly quick, and so it's likely to show things we would see in cystitis or pyelonephritis, including pyuria, which is white blood cells. It can also show some proteinuria, which is indicative of renal involvement, and it can potentially show white blood cell casts. Remember, we talked about in the previous video, white blood cells are going to go to the tubules in the kidney to fight the infection. As those white blood cells leave the tubules, they leave in the shape of casts, because inside the tubules, they can essentially be compressed together, and as they leave the body, we can see them in the urinalysis that presents something like a white blood cell cast. Now, this is a plus or minus, right? This is not always present. However, if it is present, it indicates there's likely renal involvement, kidney glomerular tubule involvement, which can be another clue that we're dealing with pyelonephritis versus something lower in the urinary tract, which would not typically have white blood cell cast. On a CT scan in these patients, you're likely to see corticomedullary scarring and blunted calyces. So remember, this scarring occurs because this is a recurrent or persistent problem for the patient. It's not like the kidney gets inflamed one time and then they're all better. It gets inflamed, they start to get better, it gets inflamed again, it continuously gets damaged over time, and that's what actually leads to the scarring in these patients. Now, I want to point out a unique imaging finding that we see in a subtype of chronic pyelonephritis, which we talked about at the beginning of this video, that is xanthogranulomatous pyelonephritis, and this is called the bear's paw sign. And the reason is because if you look at this kidney, you can see this kind of circular formation, right? And the idea is that this actually looks like a bear paw. So this imaging finding would tell us that a patient likely has a subtype of chronic pyelonephritis known as xanthogranulomatous pyelonephritis. This is a fairly unique imaging finding, so I want you to be familiar with this, because if you see this on a test question, I want you to make that connection and start to be thinking about this particular pathology from the get-go. Now, another fairly important thing to keep in mind here is the histology, which we describe as thyroidization of the kidney. So if you turn your attention across the screen over here, you can see these kidney tubules with kind of a glassy appearing proteinaceous material, which is called colloid. This colloid is a bunch of eosinophilic material that is a result of the chronic inflammation overall. And the reason this is classically called thyroidization of the kidney is because if you compare this to our thyroid biopsies, this looks really similar to our thyroid tissue. And so seeing this presentation, seeing this image right in a kidney picture, this is the first thing I want you to think of as chronic pyelonephritis. If they tell you that it's a thyroid, right, assume it's a thyroid. But if you have any indication that the pathology is referring to the kidney itself and you see this, this is not a thyroid. This is related to a specific histopathology that is seen in chronic pyelonephritis. Now, when we talk about management options here, we're going to do our typical things we would do for a urinary tract infection, which include antibiotics, treating the underlying cause, which often involves removing the obstruction. We said we can have a kidney stone in the way, particularly if the patient does have a Proteus infection and they do have a struvite stone. We know that those typically need to be removed surgically because they're so large that we'll never pass them through the ureter itself. And you're likely to consider a nephrectomy for patients who have xanthogranulomatous pyelonephritis, which again is a subtype of chronic pyelonephritis, often seen this bear paw sign. So a classic vignette for this type of pathology might include a 67-year-old patient who presents with recurrent urinary tract infections. They have a history of 3 cases of pyelonephritis within the last 12 months, and they've been treated with antibiotics each time successfully. However, the patient is presenting with similar signs and symptoms, flank pain, fever, and so the clinician orders a urinalysis and a CT image to look for any obstructions in the urinary tract system. On the CT, they might show you this image, which is why I want you to be familiar with it. Or they could talk about getting histologic results, right? I could see a very good question being written that tries to trick you by giving you this histopathology image, making students think it's thyroid tissue because that's what thyroid tissue classically looks like. But they're talking about a patient with kidney problems, right? They're talking about pyelonephritis, they're talking about fever, urinary symptoms. So we're unlikely to be dealing with a thyroid in those types of patients. So this could be a classic clue to indicate that this patient has chronic pyelonephritis because they're showing you this image, which is consistent with thyroidization of the kidney tubules. And so just to quickly summarize this video and give you the high points here, we're dealing with chronic pyelonephritis. Similar causes and presentation as acute pyelonephritis, but it's chronic, it's occurring over time, it's recurrent, it's tough to treat, it keeps coming back, and over time you get scarring of the kidney. While there are a variety of different things that can cause pyelonephritis, when we think about chronic cases, we typically think about one of these things, whether it's a bacterial infection or specific anatomic risk factors. And while the presentation and diagnostics can actually be fairly consistent with acute pyelonephritis as well, there's a couple unique things that we want to be mindful of that can differentiate acute versus chronic pyelonephritis. That includes some imaging findings as well as histologic findings. When we're dealing with management, same thing that we would do for any other type of pyelonephritis. We're doing antibiotics, we're treating the underlying cause, and in certain cases, we might consider surgical intervention.